36 states were rendered unconstitutional. More on this story from George Herman.
In 2 related cases and 8 separate opinions, the 9 justices made abortion largely a private matter and ordered the states to make no laws forbidding it, except possibly during the final months. The court split 7-2, with Justices Byron White and William Rehnquist dissenting. In effect, the court makes abortion subject only to the decision of the pregnant woman's doctor. It ruled that states may make no laws restricting a doctor's right to decide his patient needs an abortion and to carry out that abortion during the first 3 months of a pregnancy. After that comparatively safe 3-month period, abortions may be regulated, but not prohibited by state law and for the benefit of the mother's health alone. Abortion is somewhat more dangerous at this stage, and states may insist, for example, that they be performed in regulated hospitals. Only in the final stages of pregnancy may states intervene and say no to abortion. The court's decision, written by Justice Blackmun, thus sets limits on the right to abortion on demand. One limit is the time when doctors believe the fetus may be able to survive outside the mother's womb. At that point, usually in the 7th month of pregnancy, the state may take legal action to protect the unborn child, even forbidding abortion except to protect the mother.
The amount of women that get abortions come from all walks of life, and it is a very large percentage of our community. In 2013, unmarried women accounted for 85.2% of all abortions. They were not able to support a child on their own. Women in their 20s accounted for the majority of abortions in 2013 and had the highest abortion rates. They were probably trying to make sure that they had a full life and that they had the money to support a family in the future. Adolescents under 15 years obtained 0.03% of all 2013 abortions. Women aged 15 to 19 accounted for 11.4%. So no, not all people who get abortions are underage kids. Percentage of 2013 reported abortions by age of mother. Women living with a partner to whom they are not married account for 25% of abortions, but only 10% of women in the population. If you look at this chart, you can see the percentage of age groups that got abortions. The largest was 20 to 24, which is an age where you're trying to find yourself, you're trying to figure out your own life. Abortion itself actually started to lower the amount of children that were put into the foster system or the adoption system. This caused many children to feel unwanted and unloved because the foster system is a very hard situation for many children to go through. Once Roe v. Wade became legalized, foster and adoption rates went way, way down because there weren't as many children that were unwanted that were being put into the system.
Hi, my name is Karen Crisp.
Okay, so what are your thoughts on abortion?
I think abortion is a personal choice. There are a lot of different reasons for abortion, and I think that every woman has the right to make those choices.
Do you think that when both the mother and fetus's lives are at risk, abortion is a viable option?
Yes, I do.
Have you ever had a life-threatening pregnancy that an abortion would have saved a lot of pain?
Yes, I do.
What happened?
I had a tubular pregnancy, and it was very painful. I tried to carry it, and I ended up having a miscarriage. So I went through the pain of the miscarriage and then had to go through the process of a D&C, which is what they do when they have abortions.
Do you believe that it would be cruel to force a child to grow up in an unloved and unwanted environment?
I do.
And do you think that the death rate will spike if abortion becomes illegal due to back alley abortions?
Yes, I do.
Do you know anybody who has had a sketchy abortion?
I do.
Who? Or what was their situation? I guess would be the better question.
It was a friend in high school, and she didn't talk to anybody before she went and had it done. She went to a facility that was not licensed, and she ended up not being able to have kids because of that sketchy abortion she went on.
That's horrible. Do you believe that Planned Parenthood should stay funded so that women are able to get the resources they need to avoid an unwanted pregnancy and avoid the abortion?
I do, and not just, I guess what you said is to avoid an unwanted pregnancy, because I've been to Planned Parenthood in my life, both for myself and for friends, and they don't just rush to abortion. They counsel, they talk to people, they tell them what their options are, they give them direction, they get them the resources. If they decide they don't want to abort, they provide them with the resources to adopt the child out. They help them have a healthy pregnancy. For those who want the abortion, they make sure it's safe. For those who don't want to get pregnant, they make sure that they provide the resources so that doesn't happen.
Do you believe there are a lot of misconceptions about Planned Parenthood?
I do.
Do you think that Planned Parenthood actually teaches kids more about sexual education than the schools do?
I do.
And would you suggest it to others as like a viable source of health care for girls or men that don't have the money to go to a regular physician?
I would.
What are some of the common misconceptions you have that other people have about Planned Parenthood?
They think Planned Parenthood is all about getting an abortion. They think they're abortion mills. That's not the case. They're there to help the people that have to make that hard decision, and they're there to help the people that don't want to make that decision and have no resources or are afraid to go to their parents or other people for help. So they provide that assistance so they can make the right decisions.
Do you have any final thoughts about Planned Parenthood or abortion?
I believe that Planned Parenthood was good for society. I think unfunding it is going to create a lot of pain and suffering for people that don't need to go through it. Unfortunately, a lot of doctors, they just believe in life. They believe in, having a child. They believe in birth, but they don't really discuss Planned Parenthood. And their conceptions of Planned Parenthood, I think a lot of times are negative as well. So the doctors and the people and the nurses who participate in Planned Parenthood, they make a difference in lives that most people don't understand.
Pregnancies have many complications. One of the biggest is pre-existing conditions, which is 28% of pregnancy complications. This means it could lead a child to have a sickness that could be life-threatening to them in the future. About 1 in every 50 pregnancies in the U.S. is a tubular pregnancy. Between 6 to 16% of pregnant women who have to go to an emergency department in the first trimester for bleeding, pain, or both. A tubular pregnancy can often end in a miscarriage, or in even severer cases, the death of the mother and the fetus.
Are there ways that we can work together to reduce the number of unwanted pregnancies so that we actually are reducing the sense that women are seeking out abortions? Mm-hmm. And as an example of that, one of the things that I've talked about is how do we provide the resources that allow women to make the choice to keep a child? Have we given them the health care that they need? Have we given them the support services that they need? Have we given them the options of adoption that are necessary? That, I think, can make a genuine difference.
I'm Cecile Richards, president of Planned Parenthood Federation of America. At Planned Parenthood, our motto is care no matter what. No matter where you come from, where you live, who you are, or how much money you make, you have a right to health care. But right now, politicians in Washington, D.C. are threatening to end access to birth control, breast exams, and cancer screenings for millions of people who count on Planned Parenthood. In other words, to defund Planned Parenthood. As these politicians know, federal funding isn't used for abortions. We disagree with this policy, but we adhere to it, to the letter of the law. Even knowing this, politicians have threatened that unless we quit providing safe and legal abortion to women in America, they will sign legislation to cut off the ability of millions of people to come to Planned Parenthood health centers. And if we accepted their so-called deal, they hinted they would not only keep our funding, they might even increase it. We would do anything to serve our patients, but we will not turn our backs on women. We will not give in to threats or bribery. We're proud to be there for the 1 in 5 women who have been to our health centers. We've seen what happens when women have access to care. Today, we're at a 30-year low for unintended pregnancy in America and a historic low for teen pregnancy. 55 million women have access to no copay birth control, and that's the progress we can make when we work together and put women's health and well-being ahead of politics.
I just was in the position that every woman knows, on the table with my legs spread apart, and this man is inside me, scooping me out as if I were a piece of fruit or something with this implement.
I could not believe that I was seeing this. I just went home and cried. Someone gave her a hanger abortion, perforated her uterus and her bowel, and by the time she came to the hospital, she was in septic shock and she died.